So in this video we're actually going to talk about what a pinched nerve actually is. And a lot of patients will come in with different signs and symptoms, so I want to kind of clarify a little bit about what we're looking for when you come into our office. A pinched nerve can manifest itself in many different ways. It can cause numbness and tinglings in different areas of our hands or down in certain parts of our arms. It can go and extend down to certain parts of the legs and actually down into the feet. And the neat thing about neurology is neurology doesn't lie. It's very, very clear. If there's a nerve that's being irritated, it's pretty predictable in what it's going to do in most cases. So when we go back to the nerve chart over here, as you can see, anatomically we have all these nerves here coming out of our neck, and these are called the brachial plexus. And anywhere from the levels of C5 down to T1, we form these group of nerves we call the brachial plexus. And if you notice, they only go in one direction, down to our arms. So when patients are coming in with any kind of shoulder pain or any kind of numbness into their extremities and down into their arms or actually down into the hands, one of the first things we're looking for is to see if there's any kind of irritation that could be occurring up into the neck. Likewise, when we get any kind of nerve irritation affecting the lower lumbar spine, we can affect to see changes anywhere along the leg down into this area. And as we see the brachial plexus up here, this is more of a lumbar plexus or group of nerves that actually form into the sciatic nerve. But anything above it can show different signs and symptoms, either manifesting as numbness and tingling in the front of the legs, like I said, all the way down to their feet and toes. Now, there's various degrees of nerve irritation. It could go from like a numbness, tingling like we talked about, and it can progress to more of a pain, to a certain sharpness, and it could actually go to a lightning sensation. And there's various or many things that can cause a nerve to be irritated. It can be irritated due to a disc herniation, it can be due to arthritis or a spur that's putting pressure on it. It could be actually just a localized irritation to that nerve root due to spinal dysfunction or chronic deterioration at that level. So chiropractors are very much trained to look for these kind of things, and a lot of people don't realize that chiropractors treat people with pinched nerves. And so that's why I wanted to spend a few moments talking to you about that today, because we are skilled. We are skilled in clinically determining what levels they're coming from and offering specific techniques to actually help you with that situation.